Thank you so much, Dr. Didier. Thank you. Thank you. That was wonderful. We're going to get ready for are we going to answer some of these questions now, or should we wait till the end?
Uh, any way you want it, any way you want it, Suzanne. I'm ready for anything.
Let's see here. I see this one question. Are we going to read them?
So there was one question on the chat, and we did ask the question.
Okay.
But there is a follow-up question, if we have the time. It's how can the international community come to help in terms of alleviating the issues of mental health in Africa?
Okay, that's a very beautiful question. It's very beautiful, and it's also necessary because generally in Africa or low middle income countries, mental is underfunded. Basically, less than 1% of the budget, the health budget, is dedicated to mental health, unlike industrialized countries. So there is real need. There is real need to support. Because, for instance, how can young people, how can children take the right decisions or make informed decisions if their mental health literacy is very poor? But for mental health literacy levels to be increased, there is a need for mental promotion. And in most African countries, there is poor mental promotion. That is information about what is depression, what is anxiety, how to regulate emotions. It's very, very difficult to access. Even in schools, which are normally supposed to be equipped with such information, it's very difficult. Some teachers maltreat children because they don't even understand that the child that is in front of them is suffering from depression, is suffering from trauma. So there is real need to increase mental health literacy levels. Then there's also need to increase intervention, psychosocial support, because those two have to go together, because in some families, feeding is even a problem. And if you cannot eat or have a meal a day, normally you should be depressed. Poverty has been shown to be linked to severe mental illnesses. There are some children that go to school without eating. There are some children that have difficulties even having where to sleep. Like what is happening in the Southwest and Northwest and the final, actually, it's affecting, it will affect, it's affecting, has been affecting, and it will affect the mental and the resilience of the children. So these two things are really critical in supporting mental development in Africa. Investing in mental health literacy and investing in psychosocial support at all levels of the community, in families, in schools, in markets, even at individual levels. This is going to really, really support the well-being of the children, adolescents, and the young people.
Thank you so much. And we're going to also be having a Q&A later with all of our speakers. So we will have another opportunity to ask Dr. Demassosso some more questions.